We're back with Truality's Dennis Clove. Also joining us is Tony McCachran. And David Morris is back with us also. Dennis, why don't we start with you?
Sure.
You're playing music. Thank you for that. What can you tell us about your relationship with prostate cancer?
Man, that was something. That whole year last year, thanks to my wife, because I'm a man, and we usually won't go to the doctors until it's something hurting. The arm is about to fall off, so to speak. But she's like, I'm 63 years old, by the way. So she's considerably younger than I am. So she's like, we're going to schedule an appointment with our monthly physician. We're going to keep going because we want to have quality of life. So when that happens, I go to the doctor, I go to the doctor, go to the doctor. This one instance, they'd say to me, whoa, she's looking at this chart and she's like, well, your PSA is high. Bang. I don't even know what a PSA is.
And this is just last year, you're saying?
Yeah, right. And I'm, like I said, I'm a grown man, 63. I should have known this, so I should have been telling my children, you know, what to look out for. I don't even know. So she making me go. She says, your PSA, what is that? Okay, go ahead and check what you need. I'm a Christian, right? I believe, I got this faith. So I said, go do what you need to do. I came back the next month, she said, it's gone up. Like you said, it's supposed to be, I was here, it's supposed to average 4. Mine was like 10. She's like, whoa, whoa, whoa. So she sent me to the urologist and he said, Mr. Clove, I'm not gonna say you have cancer, but your body is screaming cancer. I said, well, could it be something else? He's like, well, it could be, but you need to go get that checked. My issue was not the cancer so much, because like I said, I just believe God's gonna take care of me, but getting in that MRI was the issue, because claustrophobia, and I wanna help a lot of people with that too, because they won't get in the machine, and you don't even know you have it until you get in there. But I made it through that. They say, yes, it is, and then next thing is do the biopsy. Do that, so I had to do the MRI, they found out exactly where, Dr. Fitch, this is the man right here. The reason I'm saying that is because his staff was awesome to me. Every day I went in, you know how sometimes people have good days and bad days? I think it was 2 months, 3 months, they never had a bad day. They always treated me nice. Now the whole problem with going through this is you don't know what to expect. When you don't know what to expect, it makes you have anxiety. So I'm having that, like, oh my God, what are they gonna do? Like, what is this? What are you gonna do with that? You know, that kind of thing. But they made me feel so good. The room where I had the radiation didn't look like a, you know, like a robotish room. It had nice colors. It was a warm feeling. You just lay here and they do the procedure over you, and it's done 5 minutes.
Okay, and you talk about the procedure. Now, Dr. Fitch, is there just one procedure, or is it same thing for everybody, or what kind of treatment options do people have?
Lots of options. And one good thing about prostate cancer is there's lots of options for treatment. Sometimes it's also a bad thing because there's so many choices, it can be overwhelming. You know, for prostate cancer, it can literally be everything from observation, which means that you just track your PSA every year. You know, because someone has a lower risk prostate cancer, low PSA, it's safe to follow. You have someone else, the surgery might be the best option. Someone else, radiation could be the best option. There's even options such as cryotherapy and HIFU, which in some instances are good options.
HIFU?
HIFU, which is high intensity focused ultrasound.
Okay.
So they take ultrasound waves and they literally kind of cook the prostate tissue. So that's better for focal treatments and non-whole gland treatments, but for some instances it's the right treatment too. So lots of different options out there for guys, and to your point earlier, that's why it's important to talk about it, because it gives you those options and gives you the ability to make a good choice. And burying your head in the sand isn't one of those choices.
Now, Dennis was 63 when he started having a conversation, but this is not a disease just for older men. Young men get impacted also.
Correct. So right now, the national recommendation for screening is at age 50, unless you have a family history of prostate cancer, or as black men, the age is 45. So that basically means that I suggest any black man at 45 or with a family history start their screening at 45 years old, or at the age of 50. Or if you think you have any sort of symptoms, such as, you know, you're changing urination, you have pain with urination, blood in urine, something like that. Because to your point, though the average age for diagnosis is in the mid-60s, I have family members myself who've been diagnosed with prostate cancer in their 40s and end up having to treat it. So it is incredibly important to be screened and to do it early, because earlier detection saves lives.
Okay. Tony, welcome.
Thank you.
Now,
for
you've
having me.
started a Team Tony. Talk to us, Team Tony, please, about your relationship with prostate cancer.
Well, my relationship with prostate cancer is, honestly, it's through David. Team Tony is cancer fighters sharing, or cancer survivors sharing their experience with cancer fighters of like diagnosis, just so they can walk them through the journey. You know, it's that unknown of getting over what you're going to be going through and the relationship you're sharing with others.
So when you talk about the fact that you get a diagnosis, now it's like, okay, so what's the next step? David, you were able to say, okay, I can't just sit here in fear, I got to do something. What's the do something part once you get that diagnosis? What's the first thing that we need to talk about doing?
For us, it's reaching out to somebody like a Dr. Fitch, you know, the doctors first, but finding somebody who's been through the journey and help navigating that medical system. You know, there's so many options here and there, and you never know what's right. But finding somebody who's gone through it makes a big difference, and that's what we do at Team Tony, sharing the experiences. I was 33 when I was diagnosed with brain cancer, and I didn't know anybody who had brain cancer, and it would have been nice to have someone there like me, just to offer a little bit of insight and inspiration to what was going to be next.
Yeah.
And that's what we do at Team Tony.
Okay, and how do people find Team Tony? Are you locally based here in Sarasota?
We are
Bradenton
locally based,
area?
Tri-County, and we're in Tri-County because that is our support. We get support from Tri-County, so that is the area that we support.
Okay, and talking about support, Dennis, one of the things that I understand Truality has always done, but you play concerts quite a lot for raising money.
Well, I love giving back. I'm just a giver. I'm not like a taker, but anytime I can help take. So anytime somebody asks us to come sing somewhere like that for any kind of reason, we don't look at money as an issue, because like I say, I'm 63 years old. God has taken care of me. We live well, but you can't take money with you. But we can help some other people. It's what I want to do with the knowledge that I have, because like I say, it's a scary thing when you're going through something and you don't know what to expect. We had just bought a new house. I'm designing, I love decorating and all that other stuff. But when they told me, I think you have cancer, I don't want to decorate no more. I don't want to, you know, I wasn't sad or nothing like that, but I'm like, why should I spend $5,000 on a chandelier and I may not even see it when it arrives here? You don't want to do nothing. All you want to do is survive. But if I had somebody like these guys to talk to, Dr. Fitch, like I say, they helped me out tremendously, letting me know, okay, you don't know much about it, but we can walk you through it. It wasn't that bad.
And now you're going to do a concert coming up
I'm going to
soon,
do a
right?
concert September 16th. All of these guys are going to be here. But mainly, the concert is, I want to let people know PSA. And when I get that microphone, and we all, I think we sold over 400 tickets now. PSA. Say that with me, PSA. Go get that thing checked. I could write a song about it, but go get that checked, because like I was thinking, because I had told my pastor, like, well, pastor, I was diagnosed with this. I want my funeral this way, and I went to an altar, told him all that stuff, because I wanted to make sure everything was taken care of. He said, man, get out of here. We're going to pray, and people like Dr. Fitch is going to help us out. So PSA, I said, I want to live for my kids. I don't want my kids to see me. And a lot of you out there, don't let your children have to see you like that. My motto this year is, somebody's going to die from cancer, but you don't have to.
Right.
Go to somebody like these guys and let them talk you through it. His staff, like I said, every day I went there, they treated me so kind. I'm scared. This big old macho man, the muscles and all that. When they bring out that needle to take blood, I'm just, oh Lord, please. But I did it because I didn't want my kids to see me suffer. And you know, I said, it's better be living like this and having to go to the doctor giving blood than to be in a coffin. And I can't play music anymore. So I'm just happy you giving us an opportunity to help spread that word.
Well, you're helping all of us, because this impacts families. When someone gets diagnosed, it's an entire family that gets impacted.
Very definitely.
Dr. Fitch, I want to ask you, in your experience, because more than any of us sitting on this sofa, you see more stories and hear more accounts of what happens. How how do you find some of the commonalities that men say is good when it comes to talking with their loved ones about whatever the condition is? All of us, you know, we get a loved one diagnosed, we all want to rush to help.
Yeah.
But if people are not forthcoming with having a conversation, your recommendation about how to have a conversation with a wife or loved one, whomever, about?
Right. Well, when I have from the patient's viewpoint, because that's the thing, it's always two vantage points. And I'm fortunate enough that I'm sitting in the middle and I'm watching both sides. From the patient's vantage point, whether it's a woman or a man or a husband or a wife, sometimes it takes time. It takes time to internalize and sort of understand and accept what's going on. Oftentimes people are focusing on the why. Why did this happen? Like, what did I do? And it's very important to refocus. You know, it's not so important what happened in the rearview mirror. It's more important than what do we have and what are we going to do going forward. So the first part from their standpoint is just understanding, okay, this is what we have, and I have support. You know, I have a Team Tony, I have a loving wife, I have a loving husband, and I'm going to lean on them. And from the family standpoint, a lot of times it's also just giving time, because from a family standpoint, you know, why won't Dad talk to me? Why won't he tell me? Why won't he tell me? And particularly for guys, we got a lot of pride. You know, we're not the fastest to go to the doctor. We're not the fastest to express and talk about our feelings. So sometimes you have to give them space, be the support that they need, because sometimes maybe they just want you to sit and watch the game with them.
Okay.
You know, maybe just go for a walk with them, and then they'll eventually open up when they feel comfortable.
All right. Thank you all so much.
Thank
Team
you.
Tony, thank all of you.
Thank you.
All right. You can reach oncologist Dwight Fitch at advocatero.com and send someone you care about to prostatesarasota.org to find out more about PSA screenings and many other health resources uniquely for men. Truality, close us out.
How many know every time I turn around, God keeps on making a way? Yes, He does. Yes. Every time I turn around, He's making